semuanya, saya Ira dari Lavender Medicare. Hari ini kami bersama Dr. Melvin dari Pan Asia Surgery di Mount Elizabeth Novena Hospital. Dr. Melvin adalah ahli bedah pencernaan dan kita akan membahas mengenai penyakit-penyakit mengenai bagian pencernaan. Mari kita welcome Dr. Melvin. Hello Dr. Melvin,
Hi,
how are you?
I'm good.
Dr. Melvin, digestive problem is a very common problem that many of us will have it. Why is it so common?
I think, digestive problems are indeed very common because of our lifestyles. A lot of us have busy lifestyle, unhealthy eating habits, poor choice of food, excessive alcohol, cigarette smoking, intake of a lot of different drugs and all that. Young people and old people having lots of digestive related problems. So the majority of my patients would present with intestinal related problems associated with the esophagus, the stomach, and of course the pancreas, the gallbladder, the liver. Common conditions that I see would be reflux of the esophagus. Most people will just call this reflux. A lot of patients also have gastric pain that may be due to gastritis or inflammation of the stomach. Sometimes gastritis can be due to this bacteria in the stomach called Helicobacter pylori, which is a very common bacterial infection of the stomach in Asia. If Helicobacter is not treated, it can lead to stomach ulcers. It can also lead to stomach cancers. So these are also problems that I see. And not forgetting gallstones, which is a very common digestive problem as well. The standard treatment for gallstones will be by surgery. Traditionally, gallstone surgery is done with conventional or what we call open surgery. You end up with a scar over the right side of the upper abdomen like this. The standard keyhole treatment for gallbladder surgery would be one 10 mm incision at the umbilicus and a couple of small instruments in the right upper abdomen. If a patient does not want to have any scar at all, we also now have this treatment called single incision laparoscopic surgery, where we can actually do all the same thing, but through a little incision through the umbilicus. And when that heals, you will not have any scar at all. Indigestion to different people mean different things. Usually it just means bloatedness, discomfort after eating, or sometimes even pain. Indigestion, if patients come with indigestion, usually is due to indiscriminate eating, either eating too fast or eating too much oily food, spicy food. So we recommend that you take healthy eating habits, maybe give them some medication to see if they get better. But if the pain persists, or if the pain does not get better with simple medical treatment, or if the pain occurs in an older person, then we would recommend that you do further investigation.
So what kind of investigation do you need to do?
For symptoms related to the upper gastrointestinal system, the commonest and the best investigation would be to do an endoscopy or what we call a gastroscopy. Other investigations we might sometimes use would be doing a scan, such as an ultrasound scan of the abdomen to look at the liver, the gallbladder, the pancreas, or sometimes we would require a more clearer scan, such as a CT scan or an MRI scan of the abdomen.
So how often do we need to do endoscopy?
Okay. There are two types of endoscopy we do, the diagnostic endoscopy and the screening endoscopy. The diagnostic endoscopy is indicated by symptoms. If you have a problem that we don't know what the cause is, then we would do a diagnostic endoscopy to find out the reason for the symptom. On the other hand, screening endoscopy is basically related to looking for cancer in the stomach or pre-cancer in the stomach. Usually we would recommend for Asians to do this after the age of 50, and we do it every 5 years, even though you have no symptom at all. That will be a screening gastroscopy.
So it is very important to do an endoscopy for people above 50 years old.
Well, when we do screening endoscopy for people above the age of 50, we look for not just early cancers, we also want to look for pre-cancerous conditions, and we also do a biopsy for this bacteria in the stomach called Helicobacter, because this is a bacteria that's known to be a causative factor for stomach cancers. So if we can find this if you have this bacteria and we detect it and we eradicate this bacteria, we can reduce your future risk of having cancer.
I also heard from a lot of people saying that if don't do biopsy because the cancer will be able to spread if you do biopsy. Is that true?
That's totally untrue. Yeah, totally
For
untrue.
all the organs?
For all the organs, well,
upper
with
gastro.
certain exceptions. Usually for cancers in the stomach, they start in the inner lining of the stomach. And when we do a biopsy, we're only taking a little sample of the inner lining of the stomach. There's no risk that the cancer can spread. In certain instances where the cancer is, let's say, in an organ that is very inaccessible, and we need to do a deep needle biopsy through the skin, what we call percutaneous, through the skin, using a CT scan to direct that needle in, there is a very small risk that this cancer can seed along the needle track.
Dr. Melvin, the most common complaints that I receive from friends or family is reflux. How do you actually get reflux, and how do you treat it?
Reflux indeed is a very common problem, especially in young people. The basic problem in reflux is that there is regurgitation of acid from the stomach into the esophagus. And when that happens, you can get symptoms like heartburn, which is like a burning sensation behind the chest. You can get retrosternal discomfort, like a discomfort behind the chest that some people think they're having a heart attack.
Yes, it's very similar to heart attack.
Correct. And sometimes when the acid goes higher up, you can get throat discomfort. You can get this symptom of something stuck in the throat all the time. And some patients even get a chronic cough if the acid flows into the lungs and irritate the lungs. So these are some of what we call reflux-related symptoms.
So in that case, it's genetic problem.
It's not genetic, it's usually acquired. It happens more in people who are overweight and obese because the abdominal pressure, if you have abdominal obesity, can actually force the stomach
to go up. Okay. So how do we deal with it?
Reflux on the whole will be treated with medication after we establish the diagnosis with endoscopy. After we do a scope and we find that the problem is due to reflux, we can start you on medication to reduce the acidity and to improve the motility of the stomach. In addition to that, we will always want you to start on lifestyle changes, healthier eating habits, better food choices, avoid things like coffee, alcohol, excessive alcohol, oily, spicy food. These are things that make reflux worse. And gradually, we hope to control you with just lifestyle changes alone. But some people will require medication from time to time.
So if we don't resolve the reflux problem, what can it lead to?
Okay, if reflux is not properly treated, the acid can actually cause erosions in the esophagus. And this long-term damage to the esophagus can cause the esophagus to undergo a pre-cancer change called Barrett's. And if Barrett's is not followed up and treated, it can lead to a higher risk of esophageal cancer. That's why we always recommend that if you have reflux, you should do regular endoscopies to do surveillance for pre-cancer in the esophagus.
So lastly, Dr. Melvin, what can we do to prevent all these illnesses?
The most important thing is to have a healthy lifestyle, less stress in your life, healthy eating habits, better food choices, don't smoke, and less alcohol. Come for regular checks so to make sure that you don't have conditions like Helicobacter and pre-cancer in the stomach. In fact, we know that maybe about 30 to 40% of the time, serious problems related to the stomach, even cancers, are due to preventable causes. Okay.
Oh, okay. Thank you, Dr. Melvin, for your time. Terima kasih semuanya sudah mengikuti interview singkat kami bersama Dr. Melvin Look. Jangan lupa untuk hidup sehat selalu. Sampai bertemu di topik berikutnya.